Imagine you or someone you love is critically ill and intubated in the ICU. You'd expect every device around them to support healing. One of the most essential tools, the endotracheal tube stabilizer, can actually cause harm. These stabilizers secure the breathing tube, yet the constant pressure they apply can lead to painful injuries. These pressure injuries form when sustained pressure reduces blood flow to the skin, and with added moisture and friction, tissue damage and pressure injuries can happen in as little as 2 days, affecting up to 20% of intubated patients. Beyond the pain they cause, these injuries can lead to longer hospital stays, increased infection risk, and are a significant workload and burden on nurses. They are also considered never events, meaning hospitals absorb the full cost of managing them.
To understand why this keeps happening, we conducted ethnographic research, including surveying and interviewing more than 30 respiratory therapists, wound care nurses, and ICU clinicians to identify the shortcomings of current stabilizers and the needs of the people that use them. We also have a nursing student embedded in our design team who provides continuous clinical insight, validating our observations and ensuring our solution fits seamlessly into real ICU workflows. We are Team 16 from Bioengineering Senior Design, and we're working to design a new endotracheal tube stabilizer that prevents device-related pressure injuries. We quickly developed low-res prototypes using readily available materials to test key design concepts and device functionality before committing to final fabrication. To test our prototypes, we applied them to a mannequin and evaluated the usability for the application, tube adjustment, fit, stability, and contact distribution, allowing us to eliminate less effective designs and select the concept to move forward with. We then began creating some medium-res prototypes once we decided the key features of our design. We created CAD models in SolidWorks and 3D printed using TPU. After some iterations, we got feedback about our prototype from a nursing student, respiratory therapist, and wound care specialist. From their feedback, we came to a design freeze, where we decided how exactly we were going to move forward with in the future to create a high-resolution design. This design features a flexible structure to conform to each patient's face, a large surface area to distribute pressure, foam lining for breathability and cushioning, a slidable tube holder to adjust tube positioning, and lightweight straps to secure the device in place. We then analyzed key hazards associated with current endotracheal tube holders. Using a risk summary along with FTA and FMEA, we identified each hazard severity and classified them as low, medium, or high risk. These findings directly informed our design, allowing us to focus on the highest risk issues and create a holder that reduces displacement, improves stability, and minimizes patient harm. To quantitatively determine the effectiveness of our design, we will be measuring the applied pressure of the endotracheal tube holder on the areas of contact on patients' faces. We will do this by calibrating a pressure-sensitive conductive sheet that's resistance responds to changes in pressure. By measuring differences in voltage, we will be able to calculate the exact applied pressure of our design and compare it to other current designs. Once the design has been verified against our requirements, we will present the final design to respiratory therapists, ICU nurses, wound care specialists, and other clinicians to ensure that it meets their needs.